two major incidents shaped me. One was my parents losing a very close friend of theirs. And then the second one in 2018, when I saw a young boy in Surulere, Lagos State, bleed to death right on the streets. No one could help, majorly because Nigerians are scared that if we help someone who is shot or who a car hits, police would arrest us. We don't also want to have problems with the family members of the persons that we help. Nigerians are scared to be good Samaritans.
Today Africa Podcast is a podcast series where we interview African entrepreneurs and professionals and share the stories behind their businesses. In each interview, we ask how they got started, how they grew, and how they run their business today. The stories are inspiring and also provide specific advice and insight into starting a business. By sharing these stories, we want to help others get started.
Welcome to another episode of Today Africa Podcast, where we sit with African entrepreneurs, business leaders, change makers, and professionals who are changing the future of the continent. And don't forget to like, share, and comment on our content on social media, and head over to YouTube and subscribe to our channel at Today Africa Studios. Joining me today is Emmanuel Osemudiame. He is the co-founder and CEO of Salvus Emergency, a tech-enabled emergency care startup based in Nigeria. Emmanuel, you are welcome.
Thank you so much, Emeka. Thank you so much. I'm glad to be here.
I believe there's more to you being a co-founder and a CEO. So tell us more about yourself.
I usually start with a very interesting fact that I am a second generation health professional. I come from a long line of health professionals, doctors, nurses, pharmacists, researchers, scientists, a couple of them on my maternal side especially. And that is the most important fact about me. I'm very proud of my roots. My ancestors have been healers per se. I spent a lot of time in the hospital. I usually say that I grew up in the clinic. My mother had a clinic as I grew up, and the clinic was in one flat and we lived in another flat, just side by side. And so I grew up seeing emergencies. I grew up seeing all sorts of clinical situations. And so growing up, it felt like that was the next thing to do in life. As children, we look up to our parents, especially. And when you throw in a little bit of gifted hands by person, you just decide, I want to be a doctor, I want to be a health professional. And I think that's the most interesting thing about me. I think another interesting thing about me would be that I spend a lot of time pushing health policies, pushing conversations with government agencies, trying to influence what health policies are in Nigeria and Africa at large.
Tell us more about Salvus Emergency. What is it all about? Everything about it.
Salvus Emergency, I'd say it's both a service and a product. How did we start Salvus Emergency? It used to just be Salvus Health, and Salvus Health used to liaise with independent ambulance services to provide emergency services during events, corporate events, parties, all of those things, football events. But because I and my co-founder, Dr. David Onoja, will tell you a lot of personal emergency stories that we have. We've lost friends, we've lost family. We knew that we needed to take it to the next level, and the next level looked like tech, bringing in tech, using tech to help a larger number of people. And so it went from just being a provider for ambulance services to emergency care, helping Nigerians especially to meet and to access and to get help in seconds. One of our popular lines in Salvus Emergency is that seconds matter to us. It takes seconds between life and death. And so we strive to instantly provide care from the point of emergency to post care at the hospital. Salvus follows you from the beginning to the end, and makes sure that we wrestle against mortality for you.
So let's talk about the inspiration behind Salvus Emergency. So what inspired you and your co-founder?
This is one question I like. I like to discuss my inspiration. A couple of events have unfolded. We're Nigerians. I'm Nigerian. My co-founder is Nigerian, and there's no Nigerian. There's almost no Nigerian that does not have an emergency story that ended sad. For me, two major incidents shaped me. One was my parents losing a very close friend of theirs. And then the second one in 2018, when I saw a young boy in Surulere, Lagos State, bleed to death right on the streets. No one could help, majorly because Nigerians are scared. We're scared that if we help someone who is shot or who a car hits, police would arrest us. We don't also want to have problems with the family members of the persons that we help. Nigerians are scared to be good Samaritans. And so I had just come back from school. It was a break. I think it was it was the World Cup season, I think, and I had watched somebody just basically I watched him pass from life to being part of the mortality data, and I think that is one event that left a mark on me. A young boy who knows, he could be the next, could have been the next president of Nigeria, or just being a good father. He's been robbed of that opportunity because Nigeria, we do not have the proper emergency structure in a sane climate, or in a sane country. I do not need to know who has been shot or who the car just hit to call 911 or to call 999 or to call 112. I should just place a call and emergency services and the police arrive to help that person. Life first before we figure out what exactly happened. But sadly, that is not the structure that we have in today's Nigeria. And that's why Salvus Emergency is here. This is what we are building. That's what we are working at. We're designing structures. We're bridging gaps. We are signing partnerships that help us to, give Nigerians a fighting chance during emergencies.
Like you said, a lot of people have died just because everybody is scared. Let me not go and help this person, and I end up going to jail for a crime I never knew about. Even hospitals are scared of equally helping those that have been shot. So what do we need to do to overcome this?
Thank you so much, Emeka. This is another good question that I like to answer often. It all comes down to awareness and education. Two major things that I usually and constantly task the content team, the marketing team, and the social media team at Salvus Emergency is, pushing for awareness, pushing for education. I do understand that we need engagement. I know we need to sell our market, but we also need to educate. Nigerians are highly misinformed about health. There is a serious misinformation on health. I do know that a lot of doctors, a lot of health workers are on the internet, social media. They are constantly pushing out health education. But we are still one of the most misinformed people in the world when it comes to health. A couple of days ago on social media, on Twitter especially, there was a lot of misinformation about postpartum care, and it led to a tug of war between tradomedical practitioners and orthodox practitioners, medical practitioners. And this is because there's a lot of misinformation. So Salvus Emergency constantly puts out data, constantly puts out information, constantly puts out enough videos, enough documentaries and all of that, which is accessible on our YouTube, on our Instagram, and on our Twitter. We do a lot of this education. We try to re-educate Nigerians. Nobody's going to arrest you for calling Salvus on our USSD code. Nobody's going to arrest you for calling the police. No, there is no law like that. And hospitals who reject, they do not reject because they are scared. Hospitals reject patients in Nigeria because there is a scale, there is a level of trauma that each hospital can handle. There is a primary level, and there is a secondary level, and there's a tertiary level. You cannot take a gunshot wound to a primary healthcare center in Nigeria. The primary healthcare center will most likely reject you, but they will not just outrightly reject you. The law does not allow health workers to reject. The law allows health workers to refer. So we do not reject, we refer. It's just Nigerians in their angst and in their desperation and their frustration will say, oh, the hospital rejected me. No, the hospital did not reject you. They asked you to go to a hospital that has better equipment, that has the right specialist, that has available bed space. And that's what, and this again is the miseducation and the misinformation in Nigeria. The fact that someone rushes their father to a primary healthcare center in their neighborhood by 2 a.m. and they expect the matron to handle a gunshot wound. No, she's a matron. She handles maternal issues. She handles birth. She does not handle gunshot wounds. And so they refer you to a general hospital, a specialist hospital, or a teaching hospital, and then you come on Twitter and say, oh, they rejected me. No, they did. No, they did not reject you. And so this is the misinformation that Salvus Emergency is trying to correct.
How does Salvus work, and how fast do you people earn to reach someone that needs your service?
You can access the Salvus Emergency platform in two ways: through a USSD code or the app for the tech-savvy people. And from data that we have in Salvus, because data is a very important part of what we do at Salvus Emergency, 150 million Nigerians have access to a phone. 100 million of them have access to a tech-enabled phone, and only 30 million of them can actually operate this tech-enabled phone. So you see that we have another 120 million people who own a phone but are not necessarily connected to the internet, and that's why we have a USSD code. We say that seconds matter, so we typically want to reach you in minutes. In the moment you call us through the USSD code or you ping us through the app, we triangulate through our AI system where you are. You are in Ogun State. Where in Ogun State are you? You are in Abeokuta. We see that you are somewhere in Itoshi or Itoki, and then we know that this is where you are. We find you not the closest hospital, but the right hospital. There's a difference between the closest and the right hospital. Salvus Emergency is not selling the closest hospital. We're selling the right hospital because, like I said, before, the right hospital could be a maternal care clinic, and what issue or the emergency could be a gunshot wound or a road traffic accident. No matron can handle that, and that's how Salvus works.
So what's the USSD code?
752 is what Salvus is working with.
Okay, 752.
Yes, 752.
You are in the business of rescue, making sure that people survive all kinds of emergencies. So which technology or tool in your stack gives you the biggest edge in emergency response?
I would say data. Before the public got to know about Salvus Emergency, Salvus Emergency is about 14 months old, but we've spent a year gathering data across Nigeria. I can beat my chest and say that we have data that even the federal government of Nigeria does not have. Instead of going on the internet to source for data, what we did is employ a team, of data analysts, a team that goes on the field and mapped every hospital. I can give you data from local governments in Lagos State. I can give you data from spaces and areas in Abuja. We say that we go from Lagos to Abuja. And we still have that team working currently as I speak. We have them mapping. Because we are providing and promising precision. Precision is in data. Data is precision. We can tell you how many beds are available in Luth. I know that from data that we have available, Luth, the Lagos University Teaching Hospital, which is a federal-owned teaching hospital, provides you with 3,000 beds. And I can tell you primary healthcare centers in Lagos State that only has 8 beds and 5 staff. I know this because we have data. There's tech, we have AI embedded in our tech, but no, The real secret is our data, which we have gathered for close to a year.
Let's talk about your co-founder. How did you people meet, and what convinced you or what convinced him that the two of you are compatible to start up Salvus?
Interestingly, we met on social media. We met on Twitter.
Okay.
We met on Twitter. I don't know if I convinced him. I feel like he just pitied me. but David is a very smart human being. He's research focused, he's data focused. David does not want to take a decision without data, and that's one of the most important important character about a researcher. David is core research. David is core clinical. Um, I know that before going on to get his master's from the London School of Infectious Diseases and Tropical Medicine, he's practiced medicine for about 7 years in Nigeria. He currently works out of our London office. He basically runs everything. He operates and runs everything from um, handling our independent ambulance partners, to making sure and verifying every hospital, trauma center, and specialist that we work with. He also assists me with other executive functions. He's a very important part of our team. I dare say he's the most important part of our team, because he comes with a lot of clinical experience, a lot of research experience. He takes on every of our research associates that we have in Salvus, and he brings them up, he teaches them, and he primes them for global dominance.
How does your platform authenticate responders and protect users?
We follow every guideline that is available to make sure that we don't get into trouble. One of the is one of the most important boxes that we make sure to regularly tick. And how do we do that? Our platform uses standard encryption methods to make sure that our users, our patients' data does not go out. We also follow industry best practices like end-to-end encryption and regular security audits to protect user privacy. That's how we make sure that people's data does not go out. There are a couple of licenses that are important. We have them. We follow every guideline, especially HIPAA. We are licensed to make sure that we do not go overboard. And with the introduction of AI, we believe that AI is going to also create cracks in the system. We constantly audit our system and make sure that there are no cracks so that people's data, because I believe personally that health data is the most important data. So we make sure monthly to confirm through our audits that there are no cracks.
Yes, you have talked about how you operate, but I'm wondering that you will have ambulances.
Salvus operates and stays floating through our partnerships. We have partnerships across board, partnerships with other health startups, partnerships with independent, private owned ambulance companies, land, marine, and air, partnerships with local and international hospitals, partnerships with a couple of medical tourism companies and startups. This is how Salvus makes sure that we get to you and give you a fighting chance.
Emergency infrastructure is very expensive, and this is taking me to my next question. So, how are you scaling across regions with different resource levels?
Partnerships.
So, how are you able to convince these partners to partner with two people, saying that you are just 14 people?
Our USP is filled with value. Our USP is filled with value, and when people see value, they see money. And when people see money, nobody wants to leave money on the table. It's and of course, it's business. Yes, we are saving lives. Yes, the whole idea is to save lives, but money has to be made. If we don't make money, we can't keep the lights on. If we don't keep the lights on, there is no Salvus Emergency. And these partners that we have, these strategic partnerships that we have, understand this as much as we do. And so when we approach them, or in some cases when they approach us, and we see that our goals are aligned, it's a fast flow from there.
In your business, what metric matters the most?
I would say response time. Well, a couple of them. There's response time. There's how many people we've saved. There is response time. There's how many people we save. There is how much data we have. There's how much money we've made. But I would say is how many lives saved. I think that is the metric. That is the emotive metric for me. But business wise, I would say response time, because precision is tied to time. If you are fast, then you can actually claim precision. You are fast, you save lives. Yes, you can claim precision. So I would say response time. We typically like to get to our users, our patients, in record time. And because we were meticulous enough to factor in the Nigerian issue of traffic, because we also know from data and research that Nigerians are desensitized to the sounds of siren and alarms. Our business structure and our operational structure helps us to sometimes send motorbikes, power bikes with first responders to go help these people, give them first aid, and get them to hospitals as fast as possible. So yes, response time is our metric of success.
Speaking of this metric, have you ever received a false alarm before?
Yes. Oh yeah. Of course, yes. Even hospitals, even brick and mortar emergency centers receive false alarms. The police receives false alarms. I do know that in Lagos State, 767 works for the police and 112 works for the police. And I know from interaction with LASEMA, Lagos State Emergency Management Agency, that they receive a high amount of false alarms. A good example for me would be when once somebody bot dialed our USSD code, So yes, we receive our fair share of false alarms.
You mentioned the Lagos State Emergency Board. So don't you think that servers and these Lagos State Emergency Board are almost operating the same way?
I would like to say that we both are trying to create the right emergency structure. Salvus Emergency and LASEMA, government owned, and Salvus private owned. They have data, we have data. They have fleets, we work with fleets. Salvus Emergency is larger than is wider and larger than, bigger than just the app, just the USSD code, and our partners. Salvus Emergency offers you a product we call Medical Visa by Salvus. Helps you to leave Nigeria and go outside the country for treatment, especially emergency type of treatments. There are a couple of medical situations that unfortunately cannot yet be treated in Nigeria. The Medical Visa by Salvus, through partnerships with hospital in UAE, Dubai especially, the United States of America, the United Kingdom, Germany, India, and Egypt, helps you to quickly, in a matter of 2 weeks, leave the country to go treated. We also have another product called the Emergency Savings Account by Salvus, which we operate through partnerships with a couple of HMOs in Nigeria and outside of Nigeria. So Salvus is larger than just ambulances, but it is worthy to note that while it can be said that Lasema and Salvus Emergency are doing the same thing, it is worthy to note that many times Lasema can only handle about 34 to 35% of genuine response calls that they get, while Salvos is aiming for about 60% to 70% of those. And in the coming years, 80 to 90% of those.
Since people started servers, have you people ever lost a patient that you went to rescue?
I don't think that I can answer that. I don't think
Uh,
I don't think that again is health data, you know, and I don't think
yeah,
that
true.
we're allowed to speak on health on such. But mortality is part of life. Mortality is part of life, and you will experience it at some point.
Yes, I know people have partners and people are not an NGO. So how do people monetize your platform?
Through subscriptions, through service fees, and partnerships. These partnerships put money on the table, and we take the money. Especially, like I said, through our HMO partnerships and through our medical tourism partnerships. Right now, Salvos can take you to Dubai. As you know, and it's publicly known, it's really hard for Nigerians to go to Dubai right now. But the medical visa by Salvos will take you to Dubai for anything that you want to do. And this partnership is in collaboration. This partnership is with Wakanao Group, where we've had back and forth conversations, and it's a strong partnership that is going to do wonderful things for the medical tourism world. You know, so and then there are service fees, there are subscriptions, because on our platform, again, like I said, we don't just offer you ambulances, we offer you other services, and so these services come with fees. And then for our day-to-day daily users, they come with, you have to pay a type of subscription to access our services or what we're offering.
So how do people balance serving the vulnerable communities and equally staying sustainable in business?
It is a question that comes up constantly during meetings at the office. It comes up constantly when I and my co-founder have private conversations. How do we make sure that we don't run out of money? How do we make sure we're able to balance things? We are currently talking with Leap Africa, to do some sort of CSR to other underdeveloped communities. A couple of months ago, I I was at Makoko, with the team at Leap Africa to see what Salvus Emergency can do. I noticed in my time there that there is no functioning hospital. So currently, there's a conversation around, bringing emergency services to that community. And once we can successfully do that, we intend to replicate it in other underdeveloped and underserved communities. We have data from that community, um, disturbing data, and so we intend to use that data to serve these communities.
Since people started, what have been the challenges and how do people overcome these challenges?
For me, the most important challenge, because challenges are important, when challenges have come to us at Salvus Emergency, what we've done is sit down and find a way to either go around it or go through it. So they are important. Most important challenge for me has been our competition. Why? Because when we speak to people about our product and our services, they are quick to say, we already know a company that is doing it. So we are now left to tell you why we are the ones you should work with, or we are the ones you should you should use, or we are the ones you should invest in. you know Typically the typical answer would be funding, but no. It is helping you to see, because we need to open the eyes of Nigerians, like I said in the beginning. And how do we do this? We do this through engaging you, educating you, and creating awareness. And no, and now Nigerians are beginning to see that we are the we're truly the only ones that can help them in an emergency. Through our conversations, our day-to-day conversations on and off social media, we help them to see that we're offering them life through speed.
What kind of alliance do you look for, and why?
We look for alliances with the government. The government are the policymakers, and there will be no emergency structure without the right policies. For example, there was a time hospitals were not allowed to take a gunshot wound victim in Nigeria without a police report. That led to a very large number of deaths because a lot of police stations want to go through a long line of bureaucratic drama before people can get police reports. And seconds matter in emergencies. Nigerians have lost their relatives, their loved ones, and they have lost their lives because of this particular example. And so we constantly push for alliances with the government to help shape the policies, to help shape data, and to help shape structure. Another alliance that we look towards, or we look for, or we push for, with insurance companies and hospitals. If we make sure to know what hospitals to go to, and to make sure to know that these hospitals are duly verified, registered, and operated by the right persons, it will give Nigerians a fighting chance. And then with the insurance companies are the ones that process money in Nigeria. They process the largest amount of monies in Nigeria. And we at Salvus Emergency, we are very interested in making sure that Nigerians take health insurance important. Nobody plans for health emergencies, but they come. They are part of life. And one of the best things that anybody can do for themselves is to have health insurance. When you get into an emergency, you have health insurance. You can focus on getting better. You can focus on fighting mortality. You cannot be fighting mortality and looking for a 1 million naira or 2 million naira from somewhere, from nowhere. So it's another thing that we do at Salvus Emergency. We constantly educate Nigerians, go register for health insurance, and there are a couple of health insurance companies in Nigeria. Matter of fact, there are at least 100 of them. Small types, big types, private types, government types.
Has any collaboration surprised you by how much impact is unlocked for your business and equally for the partners?
I would say the collaboration with medical tourism companies, that has been a good collaboration, especially with medical tourism companies in the United Arab Emirates. You know that has been a good one. It has helped us to save Nigerians. It has also helped us to expose our partners to Nigerians. Our partners now know that these hospitals are there. Because one of our partners is they are the Canadian Specialist Hospital in Dubai. They are 7 minutes away from the international airport at Dubai, strategically positioned to accept all types and all kinds of emergencies. And this is a
Wow.
good this partnership works well for them too.
Where do you see Salvus Emergency in the next 5 years?
We aim for 1 million users in 5 years. We expect that we would have aided the restructuring of the emergency system in Nigeria, because right now, like I said earlier, we have it's non-existent. The emergency structure in Nigeria is non-existent, but we're building the bridge. We're constantly building the bridge. Every day, I and David wake up thinking of how to build the bridge, how to add more beams, how to add more leeway, and that's what we're doing. So 1 million users, millions saved, new territories. We're looking to open more offices in and around West Africa, because the same emergency structure that we have in Nigeria is what some countries in West Africa have to. We are particularly interested in places like Sierra Leone and Liberia.
What lesson have you learned so far in your journey as an entrepreneur?
I told them at the office that I was going to tell you, when if you ever ask this question, don't do startup business. but but I think that the lesson that I have genuinely learned in this 14 months is you cannot sell a business, a product, or a service that you don't believe in. The only reason why you would eventually succeed in life is if you believe in what you're doing, in yourself. I originally gave myself 2 months to succeed, but I believe that we're currently succeeding and we're 14 months in. So believe, I do think that if you believe in what you're doing, you will be able to sell it. A salesman has to actually believe in the product, and that's why, if you're selling something and we don't see it on yourself, on you, we don't want to buy. At Salvus Emergency, we believe in what we're selling. We believe in all our products. We believe in emergency visa by Salvus. We believe in emergency savings account by Salvus. We believe in safety as a service by Salvus. We believe in the Salvus app and the USSD code. We believe in all of this. We believe that we are here in Nigeria, in West Africa, to change the status quo. And what is the status quo? When emergencies happen, no help. We are here to bring help and to bring it fast and precise.
Today Africa Podcast is a podcast series where we interview African entrepreneurs and professionals and share the stories behind their businesses. In each interview, we asked how they got started, how they grew, and how they run their business today. The stories are inspiring and also provide specific advice and insight into starting a business. By sharing these stories, we want to help others get started.